So I'm here again with Professor Vincent. We close the trilogy, like the Lord of the Ring, about my question, our question about the ICU. The last question will be about fellowship. How important is for people to select during their career a clinical or research fellowship?
Yeah, very important question too. And I think that if we want to become a good intensivist, we need to be exposed to a number of specialists because we will interact with these specialists in our careers. We'll interact with cardiologists, with respiratory disease people, with surgeons, of course, and anesthesiologists who do anesthesia, and et cetera, et cetera. And so it's important as part of the training to interact with these persons and to learn. I didn't mention infectious disease, which is also, of course, very important. I mean, the list could be long, but I like it because we need to have a very interactive activity with a number of specialists, and we learn a lot from them. So it's also important to move and not to stay always in the same hospital. Yes, I spent 2 years in Los Angeles, and I think it was really very helpful, of course, medically for the training, but also intellectually to be exposed to a different system. So by moving around, by traveling around and spending some time here and there, we learn a lot. We can learn a lot of good things, and we can also identify some elements that we find are suboptimal. And that's very important because we will try to do better when we are in charge. So being a resident, being a fellow, going around is a very important part of our lives.
It is one practical aspect because you have been fellows, as you a fellow in Los Angeles, as you said, you have been mentor and you have a large experience as a researcher. Is it possible today, you think, to have a good clinical fellowship together with the research fellowship, or you need dedicated time, especially for research?
That's a very complex question. The short answer is yes, it should be possible, but if you want to really conduct a significant laboratory work, as I did in my second year in Los Angeles when I was actively working on my thesis, then you may need more time for your research. But I think you should start your research activities as a clinician, because if you are a medical doctor, your research will be clinically applicable. You would like this to result in a change in patient management. Otherwise, it would be sterile. So it's important to start from the clinic. That's what I always say. Start from a clinical question. Then you go to the lab when you cannot address the question in patients, because it's not ethically feasible, because the patient population is too heterogeneous, etc. Then you go to the lab and you may do it in animals. Now, research is not only animal research, of course, you could also do some lab research. But again, if you want to come back to the clinic thereafter, it's better to start from the clinic. Then you may go for a few hours now and then to the laboratory and do some experiments, look at blood analysis, I don't know, and then you come back to your clinical work. So at least initially, I think you can combine the two, and your mentor or your leader should understand that he or she has all the advantages of allowing you to do that, to become really yourself a leader in the future.